Achilles pain is something that affects lots of runners, and today we're going to unpack what works and what definitely doesn't work. My name's Ed. I run a physio practice in southwest London, specializing in treating running injuries. Now, Achilles pain is often due to what's called Achilles tendinopathy, and that's where the tendon becomes irritated, angry, unhappy, and painful. And this is due to the tendon doing more than it can tolerate over a sustained period of time often. And runners, love running and they don't like stopping. So often Achilles pain can start as just a small bit of discomfort that you might feel at the start of a run, and then it settles down, and then after the run, the day after, maybe the next few days, it's just kind of a little bit stiff and sore, but you feel like you can kind of shake it off. And then slowly what happens is that what's called the warming up effect carries on. So it kind of hurts at the start of your run, and then it warms up and you kind of feel fine, and you can get through your whole run. The next day, or maybe even straight after you've stopped, it gets really quite sore and gets to a point where you start to worry about if it's safe to run, and maybe it even starts to hurt during your run as well. And this is where a lot of our runners get to. They feel a bit stuck. Should I continue? Should I carry on running? Should I try running differently? Should I buy a new pair of shoes? Should I start stretching? And all these questions come up. And unfortunately, the internet is full of rubbish about how to treat this condition. So what we're going to start with is just tackling a few myths around Achilles tendinopathy. And we're going to go through the top 3 myths that are here in the world of treating Achilles pain. Changing footwear, that's the first myth. Often people think that the solution is to go out and spend £150 on a brand new, really shiny pair of trainers and, feel amazing, look very, very cool. But if it was that easy, then physio practices would just sell trainers. They wouldn't sell courses of treatment, and doctors wouldn't be scratching their heads about how to treat a really stubborn condition like Achilles tendinopathy. So it's just complete fantasy to think that that is how we can treat Achilles pain and get rid of it in the long term, because of the pathophysiology of the problem, meaning, there's a structural problem. The actual tissue is damaged or is changed, and we need to load that tissue to get it back to being healthy tissue. Trainers and changing footwear might help with pain relief, maybe, but long-term solutions, we're not going to find that with buying a new pair of shoes. Stretching feels really good, and that can be, I say it's kind of a myth in terms of treating Achilles pain where we're stretching. I wouldn't say it's damaging, I wouldn't say it's dangerous. And to be honest, we can get some pain relief, and maybe mild Achilles tendinopathy, we can get some relief from doing some stretching. But again, we're looking for long-term solutions. We're looking for fast results. We don't get those from stretching, basically. I've used this analogy lots of times before. If your Achilles can tolerate this much of load, and the running that you do is up here, so 5Ks a week, and the Achilles is just not tolerating what you're asking it to do, no amount of stretching will bridge that gap. What we need to do is rehabilitation. We need to strengthen, we need to load those tissues so that your tendon adapts, gets stronger and stronger over a period of time to a point where it can tolerate running 5Ks a week. That's Maggie. You can say hello to her. And the third biggest mistake that I see people make is using hands-on treatment. Hands-on treatment feels great. It's something where you can walk out of a session and actually kind of temporarily feel like you've got a bit of a quick win. And there's definitely not, most of the time, not any harm that goes into hands-on treatment like massage or trigger pointing. But unfortunately, the tendon itself is not going to improve or heal through hands-on treatment, unfortunately. What we may get as a byproduct of that is just short-term pain relief. So yes, use it, but don't just rely on it entirely. In my practice, we have the 5-step method, and this is how we treat Achilles tendinopathy. Now, the first step is the road mapping, and this is where we're going to identify the diagnosis, confirm that it is the Achilles tendinopathy, identify the root cause. Often it's training load error, so we've done too much too fast. we've increased the volume too much, we've increased the intensity too much, perhaps dropped off from the rest that's required to be able to properly recover after each run. Or it could be the legacy of an old injury that's making the Achilles work too hard. There's a number of factors, even metabolic factors. Things like diabetes can be risk factors for Achilles tendinopathies. So it's really important we understand as best as possible some of the possible root causes. Once we've got that, then we've got the diagnosis, the root cause, and the ultimate goal, and we can reverse engineer where that patient wants to be and where they're at the moment, and just build a step-by-step plan. Step 2 is pain relief. This is where if someone's in lots of pain, then we'll be using taping, maybe some hands-on treatment, maybe some gentle exercises to just get that therapeutic kind of calming effect. Ice, shockwave can actually have a good pain relieving effect as well. Step 3 is where we're treating the root cause. And there's, again, blurred lines here with step 2 and step 3, because strengthening exercises can have a pain relieving effect. But largely in step 3, when we're treating the root cause, we're probably in less pain and we can push a bit harder and be a bit more aggressive with the treatment and rehabilitation. During this time though, we're going to be removing anything that aggravates the problem, and that's part of step 2, reducing pain. So that means reducing the running mileage, swapping to things like cross-training, cycling, swimming, cross-training, rowing, anything where you can keep your cardiovascular system going, but not overload the Achilles and continue to irritate it. Strengthening exercises that we're going to use might start with isometrics. So that's just going to be where we're loading the tendon with as much load as we can to promote a tissue response and to promote a healing response. And we might be doing this every day, we might be doing it every other day, depending on the individual. And this is the first step. Once we're tolerating that, we're getting some good results, maybe seeing a reduction in pain. Then we might start to do the same kind of exercise, but through range, depending on the individual. And then we might progress to heavier weights, faster movements. Once we're past that point, then we might move on to plyometric training. And this is going to involve some jumping, some hopping, and some hopping from side to side, forwards and backwards, depending on the individual and how far we need to get that person back to. During this time, we really want to keep our patients running, keeping them doing as much as they can, but in a pain-free way. A small amount of pain is okay, but we definitely don't want to be continuing to irritate it every time we go for a run, because it just slows recovery, if not completely prevents it. So we want our patients to be doing any amount of running, even if it's just jogging on the spot. That's going to be what we're going to be encouraging to try and maintain a little bit of running during the time that we're treating the injury. Shockwave treatment is something else that we would recommend or use in the clinic to get faster results. The jury is still out on why it helps, and there's potentially some research to demonstrate that not using shockwave is as effective as using shockwave, but for me it helps to reduce pain sensitivity and in the clinic, anecdotally, we do seem to get faster results when we use shockwave. Now, step 4 is what we call return to play testing. And this is where we're stress testing the Achilles to make sure it can tolerate everything that patient needs to do in their chosen sport or activity, or obviously if they're getting back to running. So this is where we might compare strength, endurance, we might test plyometric strength, do a single leg hop for distance, and measure left leg to the right leg, make sure we're getting within about 10% of the uninjured side. Step 5 is what we call prevent and protect. And this is where we're giving them a toolkit of things to keep themselves in check. They've made a training error. We need to educate them on how to not do that again, to make sure that they're in the know of how to keep their injuries at bay. We also do strength training. We do twice weekly classes for all of our patients who sign up for strength training at the clinic. And that's a really, really good way, an evidence-based way of reducing the risk of injury. So my name is Ed. Like I said, if you have any questions, leave the questions in the comments box, and you can also hit subscribe and I'd be happy to help. Thanks for watching.